Okay. Hey, Melody, how you doing?
Hey, great. How are you?
I'm doing good.
Good.
So this is like Unscripted Vision Therapy of San Antonio. Maybe that'll be our name or something. I don't know. But we just wanted to put a video online. I'm going to set my timer for 15 minutes, and then when it goes off, we're done. And so
Okay.
unless we run out of things to talk about before then. And so
All
this is
right.
just a basic introduction. There's really not that many ways to get our message out to people, how we're trying to help them, how many people we actually help, how many lives we potentially change. And so that's one of the main reasons I want to just try to have short discussion and, one and then maybe another one if we decide not to do this anymore, just kind of let people know who we are and not try to make it a stressful, scripted thing. And um, So this was all my idea. Melody's not necessarily even 100% behind this, and we're both hesitant to do it anyway. So uh, let's
Let's just jump in.
that's right. So it's February 10th. It is the day after the Super Bowl, and I don't know. Were you rooting for anyone in particular?
I was not. I was
No,
kind of hoping the Eagles would win just because the Chiefs have had their turn twice. So
fair enough. I think most people were that way. I'm a Patrick Mahomes fan because he's a Texas Tech guy, and
it's
so
a
it's
check.
it's an easy way for most all Red Raiders to root for Patrick
Yeah.
Mahomes and the Chiefs, but I didn't lose any sleep over it, and I thought it was pretty boring, and for the most part wasn't the best.
It was a little painful to watch in the
Yeah,
beginning.
yeah, from beginning to end, and I certainly didn't get the halftime show, but that's a whole nother discussion. It's apparently some did, and I think most didn't, but well, whatever. So, uh, I'm name is Jason Deviney. I'm an optometrist, practicing for in my 25th year. Owner of Vision Therapy of San Antonio since 2016. I've been practicing with an emphasis on behavioral or developmental optometry. Some people even mix in neurooptometry. It's all an indication to just say that you put a special emphasis on binocular vision and how it might affect uh, people in their day-to-day lives. Over and over again, we've seen the improvements we can make in people's lives by finding some way for their to get their eyes to work better together for them with less effort. And whether it's a child struggling to read, someone that's been in a motor vehicle accident, suffered a concussion, or one of our dizziness patients who don't realize how important it is that the visual system balances out with our vestibular or balance system. Uh, we're just we're just trying to figure out a way to put out the word there and see if we can get more people to reach out and see if we can help them with any struggles that they're having. So that's a little bit about where I come from in a nutshell. I think Melody's been helping patients with vision therapy longer than I have, even though I've been doing this for some version or another for 14 years? Have you? What's the length of time on your end?
I think it's been around 17 years for me.
Yeah, yeah. And so,
So yeah.
yeah.
Um, Worked for a couple different practices and ultimately found my way to Vision Therapy of San Antonio right after you bought the practice. And so we've been together now for about 8 years, almost 8 years. Does that
Yep.
sound right?
That sounds about right. Yeah.
Yeah.
And so
Um,
the
yeah.
what was your how did you ever get into the into this world in the first place?
So I got into the world through a friend of mine, Dr. Katie Want, who practices in Mandeville, Louisiana. And at the time, my oldest son was probably about 9 and was having some learning issues in school, and ultimately found out he had some binocular vision issues. And so like a lot of people, I'd never heard of vision therapy, even though I had worked in early intervention and worked with a lot of OTs, PTs, speech therapists, a lot of kids, and had the question most people have to us, why have I never heard of this? So my son went through vision therapy first, and then Katie was also a friend of mine, not just our eye doctor. So she asked me to come on board and start working with some of the kids in her therapy practice. And that's how my journey began. So worked in a few practices and then ultimately had enough clinical hours to get certified in 2013. So I've been working in some capacity in vision therapy since that time.
Cool.
So
What else? What else can we talk about?
why don't you tell them a little bit about how you got started in binocular vision? Because you have a story when you were up in,
New
is it
Hampshire.
New Hampshire? I always forget. Connecticut, New Hampshire, one of those tiny states that would
It's a
fit,
stone's
be
throw from,
swallowed up by Texas, right?
yeah. Okay. Yeah. So, I practiced in the Houston area for almost 10 years and then moved away to kind of start anew. And it took me and my family to New Hampshire. And I worked for someone else. And the idea was to buy into the practice and live there for the rest of my life. Even though I'd lived in Texas my entire life, it sounded like a good idea at the time. Uh, Being the new guy, my schedule was slow. And so it gave me the opportunity to go back and really I stumbled upon a couple of other doctors who were on different forums, and this was before Facebook, but you could go to different forums and become a member and log in and get involved in all sorts of discussions. And there was one doctor who constantly was preaching about his success with low amounts of prism, or as he called it, microprism. He was always just saying, try this, try it, just try it and see what happens. And you read it again and again. And ultimately, I decided to try it on myself, try it on most of my staff. And in many instances, you put a small amount of prism in front of one of your eyes, and it gives you this really, potentially anyway, this I remember thinking it was crazy. I mean, a crazy effect on like, why did my eyes just relax so much more when I put this in front of my eyes? Why do I feel the tension in my neck and shoulders changing to some degree? Uh, and then again, you try the staff member and everybody, and I gave everybody little binocular vision tests and tried to see what their specific potential imperfections were. And time after time, enough of the time, we saw some degree of improvement, and in the clarity of their vision and in the ability to judge depth perception, uh, things like that. And so, shortly after that, an occupational therapist approached me from outside the office and asked if she could come in and do what she does and but integrate the vision therapy side of it. And so we finally did that after going round and round on that a little bit. And she started integrating the vision side with the OT side, and we saw these incredible turnarounds in kids who were mainly at the time just struggling to keep up with the demands of school. Anywhere from the late elementary to junior high age range. Kids who would come in struggling and then walk in with one of those large books of, I forgot what was popular at the time, one of the vampire stories that I can't think of the name of right now,
Maybe
but
Twilight.
yes, that's what it was,
Okay.
Twilight. Yes. And so by teaching their eyes to work better together, track better together, on and on. I got exposure to how this actually worked. And one of the reasons most people don't have never heard of this is because most of us optometrists who leave school, we leave school never really seeing it work. And so we have an introduction to it. We learn how to do certain tests and so on, but we never implement it. We don't see the practical application of it. And so many very good optometrists out there just don't know, never knew. No, it wasn't ever, we weren't allowed to see it work, so to speak. And so, but vision therapy has been around forever. Uh, I think
Really has
ophthalmology,
over 100 years.
yeah, I think ophthalmology even was one of the first ones to try to create it
Mhm.
and make it work, and then gradually moved away from it, and then optometry took it over. So it's really the very old school practice. It got left behind with some of the other advances that optometry's made with treating eye diseases and so on. So once I saw it work, ultimately I left New Hampshire. I was ready to move back to Texas. Didn't work out, and joined a practice that had a vision therapy doctor as part of it, and got to work with him a little bit more, and eventually told him, if once you're ready to sell this practice, let me know. And that came about in 2016, and then here we are almost 10 years later. Uh, that's that's how I really saw that this was just a thing, or this was a real thing that really did work. That's my story.
Yeah. And we've really kind of evolved over the years, from just focusing mainly on children to then morphing into treating our neuro cases or our dizzy cases, concussion, post-concussion syndrome, and our binocular vision disorder cases that are a lot of adults have found us that way.
Right, right.
I think when you and I both started, there was not social media and vision, there wasn't a great way for vision therapy to get out there. But now with social media, specifically TikTok, we've had a lot of patients that have found us because they're searching and they come up with this binocular vision disorder
Right.
dysfunction, and it checks the boxes for all their symptoms, and they
Yeah.
find a way.
And they've tried everything else to try to
Mhm.
figure out what was wrong with them.
Right.
So yeah, certainly give a lot of credit to this social media, little snippets of information. They kind of self-diagnosed themselves, and by the end of the exam, it's like, well, sure enough, I mean, your eyes don't work together well, hardly at all. And so, uh,
And some of the places they've been before they find us, for example, they've usually started with primary care, who sends them to the ENT, who sends them to neurology. A lot of them have had vestibular therapy. And then after all of that, somewhere along the way, usually the vestibular therapist will say, I think it might be your eyes. I think it
that's,
might be your vision system.
yeah, that's right. And we've helped a lot of those patients. We helped pretty much, well, most of them, right? I mean, nobody helps everybody,
Right, right. Yeah.
the first patient that was sent to me from the ENT, that what was the story there? It was actually, I had prescribed some prism in his glasses. This may have even been before I think it was definitely before you and I came together as a team. He basically got some glasses with prism to help align his eyes, some vertical prism, and he went back and told his vestibular therapist, I think this guy cured me. And
Oh.
so, and that was George, going back to see Georgia.
Uh-huh.
And and so she reached out and wanted to know what I did, and then sent me another patient, and then it's just we developed a nice relationship, and the
Yeah.
other vestibular therapists on the team know to reach out to us so we can see if there's
Mhm.
anything to that as well. I mean, it's nice to be able to help those people.
Exactly.
I
Do you
think,
want to talk? I don't know how much time we have left. Do you want to talk a little bit about the kids that we see too?
sure. And that is the thing with the timer, right? I thought that would be our way of, because we could go on and on. I always tell patients I could go on and on, and so it's trying to figure out how to be succinct. But it seems like the majority of our kids that we see are often second graders, third graders, give or take. Uh,
Mhm.
they're finding it really hard to keep up with the demands of learning how to read and keeping up to level of where they ought to be. And they may have already been pulled out and put into homeschool just so they could be at their own pace. Uh, and we do 2 to 3 hours of testing in a cumulative fashion between you and I, and we can see all sorts of tracking issues laid out in front of us. So this is why they're skipping lines. This is why uh, they're so tired, or they're fatiguing when they're trying to read. Look how we'll have to show a demo of that in a future video,
Yeah,
but
future video.
the tracking can be laid out in front of us on a piece of paper or on a video screen, and no wonder
Mhm.
anyway, like I already said. Anything to add to that though?
Yeah, I just think that we can test them and see why why it's taking them maybe so long to do their homework, why they're so fatigued. And it's usually because their visual system, their brain is working so hard to try to do what it's supposed to do that it just fatigues them.
And I heard, and I can't remember who to give credit to on this before, it's easier to put up a fight than it is to try to do the work. And so,
Hmm.
so the kids that resist and were like say, where homework lasts so long and so on, they literally put forth they really put forth less effort trying to put up the fight to
Get out
resist
of it. Yeah.
than to actually put the effort in to try to get it done. And
Yeah,
yeah, so
very true.
that's always nice to see the improvements uh,
Hmm.
within 6 to 7 months.
Yeah, with these
Or
little
really starting to see improvements along the way prior to that. But once we get
ones.
our typical program, starting to really see how much better they are.
Hmm.
Um, and so my watch says done.
All right.
Minutes. So let's go ahead and call it that, and then we'll try to figure out a time when we can pick it up from there and see what else we can discuss and try to get the word out.
Sounds good.
Okay, then I'm going to try to figure out how to stop recording
Have
this.
it in recording and then you can edit this.
Maybe, maybe not. We go at our blooper reel.
So,
Okay, I'm going to stop recording. Okay, thank
okay.
you. Okay.